Step into any of Parkway Health's hospitals in Singapore, and you will discover that quality healthcare means more than medical care. Parkway Health offers accessibility of specialized medical procedures, quality of personalized care, and treatment at its 3 well-established hospitals: Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital. At Parkway Health, quality healthcare is about total patient's experience. It is also about tender, loving care at every touchpoint in any of its hospitals. Our reputation for excellence has not gone unnoticed. Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital are Joint Commission International accredited, demonstrating our commitment to quality, safe, and efficient patient care. Recognized worldwide as one of the leading healthcare providers, Parkway Health has a pool of experienced medical specialists, invests in medical technology, and the right infrastructure to provide value-based integrated healthcare. Parkway Health offers clinical programs that are tailored for patients to experience holistic and comprehensive care under a team of specialists. With more than 1,200 accredited specialists covering over 40 multidisciplinary specialties, patients can expect quality care and be assured of our integrated facilities and expertise, which are grounded in good clinical practice. Whether patients' needs are basic or complex, they find reassurance in Parkway Health's facilities. To achieve quality clinical outcomes and for effective treatments, Parkway Health continues to invest heavily in proven and advanced medical technologies. Parkway Health also extends round-the-clock medical service through its 24-hour accident and emergency facility, providing care for life-threatening emergencies and minor urgent care medical problems. Parkway Health operates a patient assistance center to serve as a one-stop and 24-hour service center to help patients access specialists and complex medical care in Singapore. 24 hours a day and 365 days a year, our helpline service provides medical referral and assistance in over 10 languages. Our global culture means we know and understand our patients from their perspective. People from all over the globe have come to Parkway Health's 3 hospitals in Singapore for comprehensive specialist care. Beyond its reputation for medical milestones, patients come for the peace of mind, knowing they will receive quality care by our dedicated team of nurses, doctors, and staff who understand their special needs. In realizing our vision, we seek towards achieving quality clinical service and operational outcomes. This way, when our patients step out of our hospitals, we know we have made a difference in their lives. Parkway Health, your quality healthcare provider in Singapore.
Hello viewers, this is Dr. Sam signing in today's Doctor's Voice. Viewers, today we'll get to know about some common conditions like piles, fissure, as well as anal cancer, and some common condition like hernia. For that purpose, we have got Dr. Yong Chi Young here. Dr. Yong is a general surgeon practicing at Mount Elizabeth Novena Hospital, Singapore. Dr. Yong obtained his MBBS from Australia, and later on he secured Masters of Medicine in Surgery from National University of Singapore and FRCS from Edinburgh, UK. He specializes in colorectal surgery with a passion in advancing the practice of minimally invasive colorectal procedures. He also has got special interest in laparoscopic hernia repair. Welcome, Dr. Ong, to our show.
Thank you.
Yeah. So as our today's topic is related with common conditions relating our back passage or anal canal. So firstly, I'd like to know what are the common conditions you encounter in your practice?
I think the most common condition relating to the back passage would be hemorrhoids. The lay person will know it as piles.
Right.
Yes.
If we start with the piles or hemorrhoid, can you please explain what is it?
Well, actually a hemorrhoid is a swollen blood vessel that lies very superficially at the anal canal. So the common symptoms relating to that would be there could be bleeding, or the person might feel a lump. So why there's bleeding is because the nature of the hemorrhoid, as I mentioned, is a swollen blood vessel. So if someone is passing hard stool, sometimes it will injure the blood vessel, and that person might see some blood. As the swelling may increase over time, someone with very large hemorrhoids might lead that person to feel the sensation of a lump in the anus.
Okay, so you were saying that it presents like bleeding through the back passage. What are the other conditions that may cause similar kind of problem?
Well, there are many conditions that one might see bleeding from the back passage. Other conditions such as fissures and fistula. There are other common anal conditions. Now, less likely, of course, we are worried about anal cancers that can cause bleeding too. Sometimes the bleeding is not from the anus, but it is somewhere in the colon or the rectum. And we'd be concerned about conditions such as polyps and cancers there. Sometimes you may have a condition called colitis, which is inflammation of the colon that can cause bleeding. This can also, there's another condition that is called diverticulitis that can commonly also present with bleeding.
Okay, so there are lots of causes of bleeding per rectum. So going back to hemorrhoid, who are the persons are at risk of getting hemorrhoid?
Well, that relates to what leads to hemorrhoids. Commonly, someone who has a chronic or long-standing habit of straining very hard when they are passing stool. So if you're regularly constipated and you take a long time to pass stool and you sit in the toilet for a long time, then that you are at high risk of developing hemorrhoids. Sometimes it's not due to your bowel habit like this, but in some ladies they may develop hemorrhoids during pregnancy due to the weight of the womb at that time. And even after the child is delivered, sometimes the hemorrhoids may not subside.
Okay, and how do you offer treatment for hemorrhoids? Well,
there are a range of treatments for hemorrhoids. Sometimes in minor cases, we may just prescribe medications or local treatments such as ointments or suppositories. Slightly more serious conditions, we might do some minor procedures, what we call non-surgical procedures, such as a rubber band ligation. And also, there's a new treatment called hemorrhoid energy therapy, where we use a heat device to try to heat that part up, and that causes over several weeks for the hemorrhoid to actually shrink. Now these are called non-surgical procedures, but in some cases where the hemorrhoids are very large, then we may offer them some type of surgery. And there are many types of operations that have been described. The commonest type that I perform is called a stapled hemorrhoidectomy, where we use a very special stapling device where we would cut the hemorrhoid width, and in this special technique it causes the least amount of pain as compared to the other techniques, and the fastest recovery time.
Okay, so in general, how many times following the operation the patient need to stay in the hospital? How many days?
Now, usually if we are doing a hemorrhoid operation, just an overnight stay will suffice. There are some cases where someone might have the operation in the morning and they feel well enough to actually be discharged by the evening time. But in general, most patients stay one night in the hospital.
Okay. And what about the compliance and complications in this particular surgery?
Well, no surgery is without complications. The complication rate overall for hemorrhoid surgery is low, but there are some odd cases where there are, unfortunate complications, and some of them can be minor, such as short-term bleeding from the wound, or you may have infection from the wound. These are usually self-limiting, or they resolve easily. But there are more serious complications, like sometimes due to excessive scarring, someone may actually suffer from something called a stricture, which means that the anus part has become narrowed due to the over-vigorous scarring during the healing process.
Okay. So these are the complications which may occur in a least number of cases. So now I'd like to know something about anal fissure. What is it? Can you please share a bit?
Yeah. Now, an anal fissure actually is a tear in the anal skin right at the edge of the anus. Now, actually, it is a self-inflicted injury. Usually, somebody is trying to pass a very large and hard piece of stool, and they have overforced, and in that act, they have actually torn the anal skin. Once you suffer from this injury, which is a tear in the anal skin, you would find that typically that part is very slow to heal. And the main feature with fissures is that the person will complain of excruciating pain every time they try to go to the toilet and pass.
Okay. So what leads to fissure?
Yeah, so generally speaking, it is a severe constipation and someone trying to pass a very hard stool, and they have kind of overexerted and they're forced too hard. This has resulted in an injury or a tear in the anal skin.
Okay. So in both cases of hemorrhoids and anal fissure, hard stool is a contributing factor.
Yes, for sure.
Yeah.
So I guess constipation, you can say, is a factor in both conditions.
Right. So now going back to some serious conditions like anal cancer, you were saying that how they present a patient of anal cancer or rectal cancer.
Yeah. Now, rectal cancer is much more common than anal cancer.
Right. About rectal cancer.
Yeah. So rectal cancer might present as rectal bleeding, as you have said earlier, but it might also be commonly a sense of that person feeling that they have incomplete emptying after they try to go to the toilet. So it's a sense where you will try to open your bowels, but after that you still feel there's something left. So this is one of the common symptoms of
what we call
rectal cancer.
tenesmus.
It's called tenesmus. That's the medical term for it.
Yeah.
Yes.
So when do you actually suspect when a patient came to you with parectal or a bleeding through the back passage and some problems, when do you actually suspect that this gentleman might be having rectal cancer?
Now, usually when that person comes to the clinic for a checkup, when I ask him, we start with a good history. So in a typical case of the commonest case of hemorrhoids, where we see the usual bleeding symptom, it would be something like be described as fresh blood on the paper. But if someone were to describe that, it's not quite fresh blood, it looks slightly altered or more towards like purplish, or they may describe passing blood clots. These are a bit unusual for hemorrhoids, and they may make us think that it is something other than that, such as cancer. And this a prominent feature where we may ask, is this symptom of tenesmus, like what we mentioned? You should not have that symptom when your problem is only due to hemorrhoids.
Okay.
Yeah. And we also ask if you see if the blood seems to be separate from the stool. If the blood is separate from the stool, it's much more likely to be hemorrhoids and less likely to be cancer.
Okay. Is there any particular risk of family history?
Yes, for sure. So we know that colorectal cancer do run in families. And in fact, if you look at when we study family history, usually we will ask about your first degree relatives. Now, your first degree relatives mean that it's your brother or sister, or your parents. That is the first degree. And so if you have one first-degree relative who has colorectal cancer, that will increase your risk of colorectal cancer by twofold. Okay. If you have two or more first-degree relatives who have colorectal cancer, that increases it even more to at least four times that of the general population.
Okay, we'll get to know more about this colorectal cancer and other parts like hernia just after a short break. Viewers, it's time for a break. Stay with us. Viewers, welcome back to Doctor's Voice. Today we are talking about some common conditions relating to our back passage, like piles, fissure, and cancer. And we will also get to know about hernia from Dr. Ong Chi Young, Consultant General Surgeon, Mount Elizabeth Hospital, Singapore. Let's get back to the discussion. So before the break, you were saying that how the patient of colorectal cancer present to you. So after the presentation, how do you approach such cases?
Yeah. Now, for us to make a diagnosis, first of all, the most important thing is that we need to do a colonoscopy. So this is an examination using a camera scope, a flexible scope, that we pass through the back passage, where we can directly, through the camera, visualize and see the internal lining. So this is where that if the unfortunate person has a cancer, we can see it and we can take some biopsy samples and we can send to the laboratory and we can confirm the diagnosis, that way.
Okay.
After we have done that colonoscopy, the next step is we have to arrange special scans so that we can see if the cancer has spread to anywhere else. So usually we would do a CT scan where we like to see if to look at the common site of spread, which will usually be the liver and also sometimes the lung. Now, thankfully in my practice, the majority of cases have no sign of spread elsewhere, and the best way of treatment then would be to talk about doing some kind of a surgery to remove that cancer.
Okay, and we'll get to know more detail about surgery. Is there any other treatment modality apart from surgery?
Yes, sometimes in certain cases we would recommend that patient to do chemotherapy and or radiation. Sometimes we may even recommend all three combination. So quite a common case, especially in rectal cancer, we may recommend some chemotherapy as well as radiation before that patient undergoes surgery for his rectal cancer.
Okay, so about the surgery, I would like to know when you have set your mind that this patient is a candidate for surgery, what are the types of surgery and any recent advancement in the surgery?
Yeah, usually the aim of the surgery is to remove that section of the colon or the rectum, and then after that we'd like to restore the intestinal continuity by actually making a joint. So traditionally surgeons have always performed this by what we call open surgery, and in open surgery we would make a long incision right down the middle of the belly, and that's how the surgeon will have access to all the internal organs. But these days, in my own practice, I very seldom need to do this type of operation, and I have largely switched to doing something called laparoscopic surgery, or the layman term could be called keyhole operation. Now, in such an operation, we make 3 to 4 small incisions that range between 5 millimeter to about 1 centimeter, where we would insert a camera scope as well as very fine instruments that will allow us to do the same exact job that we will be doing in an open surgery. With increasing technology, there are more advanced methods, and I also perform something called robotic surgery, which is an advanced form of keyhole or laparoscopic surgery. And in a robotic surgery, we use it to do more difficult and more complex cases, also avoiding the big open cut.
Okay, so you are saying that robotic surgery is the recent advancement in this field. Can you please shed some light on what are the advantage of using a robot in such cases in keyhole operations?
Yeah, so there is a difference between a standard keyhole or laparoscopic surgery compared to a robotic surgery. The two main differences are that the robotic surgery instrument is as if the surgeon has a miniature hand and wrist deep into the body cavity. This is unlike a standard laparoscopic instrument where that instrument is very stiff and not very flexible, and it looks kind of like a scissor with a one kind of dimension job, only one dimension range of motion. But in a robotic surgery instrument, that instrument has more dexterity and more range of movement than a human wrist. So this is one of the major advantages. The second advantage for robotic operation is that the camera gives the surgeon a three-dimension view. There is a left eye and a right eye. So the surgeon will view all the anatomy completely in three dimensions, and this gives the surgeon great advantage in terms of precision.
Yeah. Any pitfall?
Well, I think the major pitfall is that the technology is very expensive, and at the moment, the main manufacturer of the product has absolutely no competition, and so it is priced rather high, and each robotic operation runs into significant cost.
Okay. I think this facility of robotic surgery is available only in few centers in the world, if I'm not wrong.
Yes. So as you can see, I think worldwide you can see availability of laparoscopic or keyhole surgical equipment, but robotic surgery is only available in a few places, and this is largely due to the cost.
Okay, we'll get to know more about this colorectal cancer and other parts like hernia just after a short break. Viewers, it's time for a break. Stay with us. Viewers, welcome back to Doctor's Voice. Today we are talking about some common conditions relating to our back passage, like piles, fissure, and cancer. And we will also get to know about hernia from Dr. Ong Chi Young, Consultant General Surgeon, Mount Elizabeth Hospital, Singapore. Let's get back to the discussion. So now I would like to know about some cancers are screenable. And is there any particular screening method for colorectal cancers?
Yes, for colorectal cancer, there are several screening methods. I'd like to discuss about two main methods. One is called the fecal occult blood test. And this is a test where someone collects a sample of their stool and is sent to the laboratory, where the laboratory tries to pick up microscopic traces of blood. And this would indicate that this particular person should make himself available for a colonoscopy to have a more in-depth look. Okay, because if you have microscopic blood, it might mean that you might have a cancer or a polyp. Now, the second test would be deciding to go straight to do a colonoscopy. Now, the colonoscopy is the most accurate test to look for colorectal cancer. It is a direct examination, like I mentioned before, with the camera scope. And it has the side benefit also of that if we find precancerous polyps, and these are little growths that if left alone might become a cancer in few years' time. But when we pick them up, we can simply cut them off during the time of the colonoscopy, and in a sense we would have prevented this person from getting cancer in the future. So
about the colonoscopy, is there any recent advancement in the technology or any recent progress in detecting cancerous lesion and distinguishing it from benign lesions in case of camera test or colonoscopy?
Yeah, there are several advancements. In the past, when you do your colonoscopy, sometimes we would not be sure if what we're seeing is a benign growth or a cancerous growth, and we would only know when we take that biopsy and we send it to the laboratory. But there's advances in imaging techniques that we can see in so much depth and detail that we can tell with great accuracy what we're seeing on the screen is definitely cancerous or it is actually benign still. So main advances are in that, imaging. Of course, in the past, our view was only standard definition. Now, even colonoscopy, we have gone to 4K resolution. And of course, with the higher resolution, we can see more clearly and we can pick up more things.
All right. So now I'd like to know a few words about hernia. What is it?
Actually, a hernia is a very common condition where there is a weakness in one's abdominal wall that has allowed some of the internal organ to actually protrude through that wall. So what that patient or what that person will feel is that, especially when he stands up and especially when he coughs or he strains, he finds that there is a lump that will appear somewhere in his abdominal wall. And usually that lump initially may not feel much discomfort, but eventually it tends to cause that person to feel some pain or discomfort. Yeah.
Okay. So what predisposes to hernia?
There are several situations where we commonly see a hernia. The commonest hernia is called an inguinal hernia, or is a hernia that's in the groin. And in fact, it's very common in men to have a groin hernia. And this is because all men are genetically predisposed to suffering from groin hernias. The reason is that when we are all developing in our mother's womb, our testicles, which actually originally develop in the belly, have to migrate through the abdominal wall and lie in the present day location, which is in the scrotum. So in this migration, that causes a potential weakness in the groin muscle. So a groin hernia becomes very common for a man.
Of males.
Yes.
Okay. And about the treatment options of hernia, any recent advancement particularly you would like to shed light on?
Yeah, in the past, of course, we used to repair all hernias by open surgery. Now, I will perform almost all my hernia repair by the laparoscopic method or the keyhole method as well. And in so doing, we will give the patient great benefit because he will feel less pain, he will get back to his normal activity and take less time off work than if he were to do a traditional open surgery for it.
And it's similarly effective with the open one, comparing with the open one?
In fact, there are some theoretical advantages of doing a laparoscopic or keyhole repair, because in a laparoscopic keyhole repair, we have the potential to place a larger piece of prosthetic mesh, which is the commonest technique now when we fix a hernia. The use of the prosthetic, or it actually looks like a plastic net. We would routinely implant this to actually give additional layer of strength to the abdominal wall. And in an open operation, it is very difficult to place a large piece of the mesh. But in a keyhole laparoscopic operation, it's actually relatively easy to actually put a fairly large piece that will give greater strength.
So we were talking about hernias, and you were saying that males are genetically prone to get some sort of groin hernia. Is there any other particular predisposing factor to get hernia?
Yes, in fact, in any person who has undergone any abdominal type of operation where there is an incision, you can get something called an incisional hernia. And this is because every surgery that is performed has to cut through the abdominal muscle, and of course the surgeon will try to repair that muscle, but sometimes the repair of that muscle or that healing is not quite so perfect. So that part that has been repaired, it's a point of weakness where you can also get a hernia from.
Okay. And in this case of incisional hernias, do you offer same sort of treatment?
Yes, I will still offer mostly a laparoscopic type of a repair, but of course the technique is slightly different from a groin hernia repair. But fundamentally, the similarity is in also the placement of a large piece of prosthetic mesh.
Okay. So we are at the end of our show. Leslie, do you have any message for our viewers to throw?
Well, I think an important message I would like to say is that we should all consider colorectal cancer screening, and it's particularly in both men and women. If they, over the age of 50, they should consider to do some form of screening, either in the fecal testing or to go for your colonoscopy.
Yeah. Thank you, Dr. Ong, for your time. I wish you have a safe journey back to your home.
Thank you very much.
Viewers, that's all for today. Hope to see you on next episode. Till then, stay fine, stay tuned.